For providing early post-op and convalescent phase recovery care, you're going to start with your assessment. You're going to get a phone report of the patient's current status from the PACU nurse, and then you're going to identify your patient with 2 identifiers. When they bring the patient to you, you're going to collect a more detailed handoff report from the nurse, and then you're going to review the patient's chart for all relevant information. You're going to review the post-op medical orders, and you're going to assess the patient and the family's knowledge and expectations of the surgical recovery. For the planning portion, you're going to identify expected outcomes. You're going to perform your hand hygiene and arrange equipment at the patient's bedside. You're going to prepare the patient for transfer. So once the patient is in the room, ready to go, that's what starts your implementation phase of the recovery. So then the early recovery phase, you're going to assist the patient in moving from the stretcher that they were brought over on to the bed. You're going to identify your patient with 2 patient identifiers. You're going to attach the patient's oxygen line to your regulator. You're going to make sure their IVs are still hanging. You're going to verify the IV rate and check all your drainage tubes, make sure that they're all properly attached and secured and draining. You're going to maintain the patient's airway. If the patient is still lethargic, you're going to make sure that they're positioned properly. You're going to conduct your initial assessment of the patient's level of consciousness. You're going to check their vital signs again, compare them with the recovery vital signs and the patient's baseline, and continue the monitoring of those. You're going to, when the patient's able to, you're going to encourage coughing and deep breathing, the use of the incentive spirometer, and the use of the PEP device. You're going to assess the patient's GI sounds and listen for those and make sure that they're returning. You're gonna check placement of the NG tube if they have one. You're gonna check the placement of the drain tubes if they have those. You're gonna assess any kind of dressings for appearance and the presence or character of drainage. You're going to palpate the abdomen for bladder distension to make sure that the patient is voiding. If it does feel distended, you could use a bladder scanner to check that. You're going to explain to the patient that it is expected that they void within 8 hours post-op, and if not, then it may be necessary to place a catheter if there's not already one placed, and if there is one placed, you're just going to continue to monitor the drainage on that. You're going to measure all sources of I and O. Anything that is hanging and dripping is considered intake, and anything that is draining or being voided is considered output. So you want to make sure that those are all being monitored. You're going to describe the importance of all the drain tubes to the patient and all the equipment that's being used to the patient and their family, so they understand what's going on and aren't being left out. You're going to position the patient for comfort and avoid tension on the wound site. You're going to assess the patient's pain level, see when the last time they were given pain medication was, and medicate the patient as ordered, and then explain the pain control plan to the patient so they're aware of when they can have medication next and what the goal is for their pain. And then you're going to place the call light in the reach of the patient and let them know to call you for help and not to get out of bed without a nurse with them. The next phase is going to be the continued post-op care. This is when the patient is mostly awake and coherent. You're going to continue to assess vital signs. You're going to monitor wound healing, change dressings as ordered. You're going to monitor drainage, maintain drainage devices, empty and recharge as needed. You're going to provide oral care at least every 2 hours and offer ice chips. The patient's usually going to be NPO directly after surgery, so oral care and ice chips are necessary so that their mouth isn't dry or tastes bad. You're going to encourage the patient to turn, to cough, to deep breathe, to do leg exercises, the use of the incentive spirometer and the PEP device. You're gonna monitor function of the sequential compression devices. You're gonna apply compression stockings if they're ordered, and you're gonna explain what the purpose of both of those are. When the patient is able to, you're gonna promote ambulation and activity as tolerated. You're gonna progress the patient's diet as tolerated, so they're not staying on NPO. You're gonna include the patient and the caregiver in all the decision making and answer all of their questions. You're gonna provide opportunity for the patient to verbalize their feelings about the changes in their appearance or their function. So make sure that they're talking about what's going on and how they feel. Don't just let them bottle it all up. When you're finished with the immediate or continued post-op care, you're gonna go to the convalescent phase. At that time, you're going to be assessing the patient's home environment for safety, cleanliness, and availability of resources. So this is getting ready to discharge them. You want to make sure that they are able to go home and will be provided the care that they need. You're going to provide instruction on care activities that should be performed at home. You're going to keep the patient and caregiver informed of progress toward recovery. You're going to explain the time of expected discharge from the hospital and provide any answers to any questions. So once the implementation phase is completed, you're going to start your evaluation phase. So part of the evaluation would be auscultating breath sounds, monitoring vital signs and their trends compared to baselines. You're going to evaluate INO records, assess times for patient's first urination. You're gonna auscultate bowel sounds. You're gonna inspect the incisions. You're gonna have the patient and caregiver describe incision and dietary care or activity modifications or schedule modifications and follow-up plans. You're gonna ask the patient to describe how to increase activity level during the first week at home, and you're going to identify unexpected outcomes. So basically with your evaluation, it's all going to be a part of the rest of the care as well. You just want to make sure that the patient understands everything going on, and you want to make sure that they understand any kind of post-op teaching that you're giving, and that they can repeat all of that back to you. And then when the patient is discharged, you're going to record and report basically everything. So you're going to document the patient's arrival at the nursing unit, the vital signs, assessment findings, nursing measures, and the appropriate logs. You're going to continue to document factors, each of them at appropriate intervals. So vital signs every hour, however it is ordered for you to do that. So at the appropriate intervals, those will be documented. You're going to keep track of vital signs and INO, and you're going to report any abnormal assessment findings or signs of complications to the surgeon. And that's all for the post-op care.